if you have heard friends or colleagues mention EMDR therapy but wonder how it really works and if it could be right for you or someone you know, then this video is right for you. Subscribe to my channel for more mental health educational videos and advice regarding mental issues and psychological empowerment. So, what does EMDR stand for? EMDR means eye movement, desensitization and reprocessing, and it was discovered by coincidence by Dr. Shapiro in 1978. The story about her work in Central Park has now become a legend. Dr. Shapiro had some upsetting thoughts and feelings. At one point she realized that eye movements appeared to decrease the negative emotion. This experience led her to examine this discovery more systematically. So a truly remarkable therapy was born. Now EMDR has evolved into a widely used therapy for treating a number of mental problems caused by negative life events. EMDR is well researched, and it belongs to the evidence-based treatments for psychotrauma and in particular PTSD. If you want to know more about psychotrauma, PTSD and other suitable therapies, you can watch my other video. The link you can find below in the description. EMDR is suitable for children and adults of all ages. You may be thinking, I haven't suffered any major traumatic event, so I'm not sure EMDR is really for me. Most people associate trauma with big events such as life-threatening events, natural disasters, maybe a car accident or physical assault. However, many people have experienced non-life-threatening trauma, called small traumas, which is often just as impactful and harmful. The examples of small traumas are emotional abuse, neglect, abandonment, racism, homophobia, and bullying. EMDR has shown to be clinically useful for treating anxiety, panic disorder, and depression. It can be also used to heal relationship wounds or to reduce feelings of shame or guilt. This list is not complete. If there is a connection between a distressing experience and a psychological issue, EMDR can be suitable therapy. The majority of all your thoughts and experiences are captured and held in short-term memory. At night, while we are asleep, our brain processes all the information received throughout the day. Our brain decides what is necessary or helpful to our well-being and puts that information into long-term storage. But what happens to you after a painful experience? Instead of getting over it, sometimes you can get stuck in it. This can lead to changes in how you feel, how you think, and act. You may not even realize that it has to do with the event until you think about what it was like before. At the time of a distressing event, the brain can store intense negative emotions and related sensations along with the memory of the event into long-term storage. Many psychological issues are caused by this lack of processing and proper storage. One of most well-supported theories explaining how EMDR works is the working memory theory. Our working memory has a limited capacity. It can hold a small amount of information temporarily. Try to do multiple tasks at the same time, like reading, talking with somebody, and watching TV. All these things will compete for your attention, and no matter how hard you try, you are going to make mistakes or lose part of the information. And now let's see what happens during an EMDR session. During a session, we are working with a distressing memory image that occupies working memory. The emotional charge of this image occupies working memory as well. In addition, the therapist uses distracting tasks during the session. Because of the limited resources of working memory, the emotional component of disturbing event will be lost. The distressing image becomes less vivid and less emotional. The experience is still remembered, but the emotional charge will be lost. You can say that EMDR works by engaging in the brain's natural healing process. During an EMDR session, the old distressing memories are connected with new information and new, more positive beliefs about yourself. As a result, the disturbing memories don't feel scary or upsetting anymore. The only way to rid of your distressing memories is to move forward through them. Your therapist will help you to do this in a safe way. A typical EMDR session begins with you getting to know your therapist and to explore your problem. The therapist will also help you to identify important events and memories linked to the disturbances you are experiencing. During the session, you will be asked to focus on target memories or moments while you will be distracted with different tasks. Most of the therapists use eye movements as a main task. Some of us use their fingers, others work with the modern inventions like a light bar, pulsars, and headset with distracting sounds. You may be invited to follow a moving ball on your laptop screen if you're having an online EMDR session, but we can use a lot of other distracting tasks to tax working memory. For example, math tasks or taps on the shoulders or knees. Everyone experiences EMDR differently. Most are tired directly following the session and may experience some headache. Others report other side effects like disturbing dreams or feeling of emotional unstableness. These side effects usually disappear in a matter of days. Gradually, your memory will release its emotional power. When you finish reprocessing, you may feel a sense of relaxation. Many people describe this feeling as a sense of release and peace. You will experience effects of reduced sensitivity to triggers and be able to talk about the situation without becoming upset or having the other symptoms you previously experienced. I hope this video provides more clarity about EMDR. Please give this video a thumbs up. It really helps my channel a lot. But also share with your friends and don't forget to subscribe and turn on notification so you don't miss any of my content. See you next time.